One of the most important things for me and in the office is that we make sure we give people a clear guideline of exactly what to do and what not to do when they're going through lower back pain. When I look at the correction process of a condition that you're going through, I'm looking at it in 3 phases. The first phase is initially getting you out of pain, right? That's the priority right now. We want to get you out of pain as quickly as possible. The focus during that phase is mobility and flexibility, getting the muscles as mobile as possible so they can support the adjustments and alleviate the pain as quickly as possible. The second phase is looking at strengthening. How do we strengthen up that structure to make sure that we can get it strong and to prevent the relapses from coming on again? And then the third phase is protection. Okay, so now we're out of pain, we're stronger. How do we keep it there? How do we stabilize that and build from that moving forward? Today, what I'm going to do is I'm going to focus on that first part. The mobility, the flexibility, support the adjustments to get you out of pain as quickly as possible. I'm going to cover 2 stretches. The first one is known as the hamstring stretch. The second one is known as the piriformis. Both of them are critical to make sure that you get the lower back area and the muscles around it as mobile as possible. What this will do is it will help the adjustments. If you find that the muscles are really tight and these aren't stretched, often what can happen, you can come in, you can get an adjustment, feel great for the first couple of hours or feel great for the first day or the second day, and then all of a sudden, bang, you're feeling all right, you're back where you started. The reason is what happens, the body wants to go back to where it's been. It wants to resist, it wants to go back there. Most important during that phase is you help the adjustments by mobilizing the muscles around it to make sure that we can get them to stay there as long as possible. I'm going to cover the hamstrings to start with. Now there's 3 hamstring muscles. If you do a lot of sitting or a lot of driving, you'll find that these muscles will be chronically tight. The reason being when you bend the knee, that muscle will shorten and it will stay short there, so when you stand up it will lock that pelvis in and cause a lot of resistance in that lower back area. Looking at it from behind, the hamstrings attach to what's known as the ischium down there. They come down the femur and attach onto the tibia and the fibula. The best way to stretch this, it doesn't really matter whether it's high or what sort of level. I always say just start low and then work yourself up, is to rest the leg up on something that's sturdy. Often we get taught how to stretch your hamstring is to bend forward and try and touch your toes. I say drop that, just the only reason being is what you'll find is it'll pull a lot of muscles and it doesn't really isolate those hamstrings muscles the best. The best way to do it is to keep the legs straight, keep the spine straight. So you want to have a posture that's straight up, and all you want to do is you want to be bending from the hip area. So it's almost like a pendulum that's coming down, and you'll find that that'll really isolate those hamstring muscles. The first one, we're going to focus with the toe up. We're just going to bend slowly forward. I'm feeling the resistance there, and I'm just going to hold that to 30 to 40 seconds. And then I'm going to back off. As I said earlier, there's 3 hamstring muscles. The best way to get that is to then turn the toe in, turn the left foot out just slightly. I'm going to keep the spine straight again, and I'm going to lean forward. Again, you find that's as far as I have to lean forward, and it isolates a muscle on the inside of the leg. Finally, I'm going to turn the toe out, spine straight up and down, leaning straight forward, and I'm going to feel that on the outside of that hamstring muscle. As I said, you've got 3 hamstring muscles. You have 2 that come onto the inside, 1 that comes on the outside. By moving the toe in and out, it actually isolates those muscles and you'll be able to get a good stretch in there. The second muscle is known as the piriformis muscle. Again, if you're doing a lot of sitting down, a lot of driving, this muscle will tighten right up. It's a short muscle, it's extremely strong. It's located right next to the sciatic nerve, so often it can irritate that nerve that comes down the leg. Best way to stretch that is to do it while sitting. I'm going to stretch the right piriformis muscle in this demonstration. I'm going to bring the leg up. Again, keep the spine straight up and down, keep the posture straight. I'm going to contact the outside of the knee. At the same time, keeping that chest proud, I'm going to slowly move this knee towards the opposite shoulder. So I'm just going to squeeze it through that area. I'm not trying to pull it up, almost trying to bring it down, and I'm going to feel a really tight stretch right in that right buttock muscle there. And I'm just going to hold that to 30 to 40 seconds again. And then flip it over into the other side. Spine straight up and down, slowly bring this in. Now you can do this stretch, both these stretches, as much as you want. I find a great way to get into a rhythm is doing it in the morning, and then when you go to bed, it just allows the body to be as relaxed as possible. Do it as much as you can during the day, and you're gonna find that by doing this is gonna make sure you get the most out of those adjustments and accelerate your progress.